Morning.
Good morning. Thanks for popping in.
Okay, I'm going to
You
go
look
ahead and
delightful today.
Thank
And
you.
I'm going to kick it straight over to you. This is
Perfect.
Adonica from Wingwomen.
Good morning or afternoon, everybody. I'm going to go ahead and share my screen, but I did go ahead and put the contact details in the chat area so that you can follow along if you like. That said, let's go ahead and queue up the screen. Okay, so I'm the founder of Wingwomen. My name is Adonica Shaw. And for those of you who don't know, Wingwomen is a new social media platform that has a health and wellness focus. It is designed specifically for professional women. If you'd like to check it out online, it is at www.mywingwomen.com. So when I was creating Wingwomen, I had to think really strategically about a problem that I, as well as a few other people that I knew, were having. For the sake of this conversation, though, I've broken them down into personas, and if you listen closely, there's a chance that you fit into one of these buckets. So take Tiffany. Tiffany is ambitious. She's bright. Tiffany is going places. Ceilings were made for Tiffany to break them. She wants to be the CEO of her company. She may even run for office one day. She's incredibly ambitious. But on the other side of all of this ambition is the cold, hard truth that being in these really unique and some elite circles is that she may be facing really unique stressors. Some of the stressors that she may face may be her online persona, her image, the stress and the anxiety that come with being a public figure, being well-known, and of course, being a well-known decision maker or a ceiling breaker. Then there's Jeff. Jeff is a very prominent figure in his industry. He sits on a number of boards. He is the CEO of a Fortune 100 company. He sees Tiffany, and he knows that Tiffany is going places. And for that reason, he has Tiffany on his radar as a woman that he wants to move forward. He wants to give her the opportunity to shine her light, break those ceilings, and to move their company forward. The problem for Jeff, though, is that while he may want to bring her into these boardrooms and bring her into these amazing opportunities, that he may not be able to do so in a way that's strategic, that may be able to support her goals long term, for the simple fact that most of these boards or these opportunities have been male dominated. They may not have the support system to provide a level of care and support for a woman who is the first of her kind to break into those ceilings, into those arenas that no woman has come into before, but he wants to do it mindfully. He doesn't really have a solution on how to bring her in and provide her long-term support. And then there are people like Sarah. Sarah happens to be a therapist. She had previously been a travel nurse. She's just very helpful. She wants to connect with people like Tiffany, who know that they're going places, but also have unique stressors, to give her strategies so that she can scale her career in a way that is mindful, sustainable, and very unique to her as a ceiling breaker, as a woman on the rise. So what does that mean exactly? When we put it all together, how do we address all of these concerns? Well, Wingwomen's answer is a B2B and B2C social media network that gives each of these individuals or personas a place to meet all of their needs. So for Jeff as the head of a company, he gets to subscribe to Wingwomen for each of his employees that he wants to give access to our unique platform. He pays a monthly fee for them to have access and to get all of that support that perhaps his board or the people that are in his immediate network, where he may be bringing these women to these amazing opportunities where he may not have that strength, he provides access to the platform for her. Tiffany down here at the bottom has access to the back end of the site, where she can go into our topic areas, which cover information around mental health tips, family changes, legal problems. How do you navigate all of this from a health standpoint? She gets access to that side of the platform, but she also has the ability to go into the career area, where she can discuss ways that people who are lateral to her are managing social and emotional health, self-care, and their wellness. So that way she gets to talk to other women that she knows are on her level and are likely to have similar stressors. Gives them the opportunity to expand in their career, so as they move up, they move through the different career areas on the back end of the site as well. And then lastly, there's Sarah. People like Sarah can pay for a Wingwomen expert profile where they get access to the timeline. They can put information in around their practice, around their expertise, around their advice, and things that they feel overall would be helpful to people like Tiffany or to up-and-coming ceiling breakers. I know I just touched on it, but the obvious question is, how would all of this work from a financial standpoint? Here's a brief look at the financial model. For Tiffany, it's going to be free for her, right? But we are working on a way to bring in the micro tip add-on, so to speak, for her to tip people like Sarah when they put things into the timeline or respond to user questions that they find to be incredibly valuable. I mean, I think it's wonderful sometimes when we're on social media and we have the opportunity to ask for advice, but when we get something that's amazing, that's life-changing, we should be able to tip that person. And so the end user has the ability to tip people like Sarah. And then there's Jeff. Jeff, as I mentioned earlier, is going to pay a monthly fee per user or monthly fee per employee to be on this platform. Jeff works with his HR representative. They get people to sign up through the benefits enrollment period, and they provide this service to them. So they're covered from a liability standpoint, and they are mindfully and progressively supporting up-and-coming ceiling breakers and women in the rise within their organization and or company. And then lastly, people like Sarah. People like Sarah are Wingwomen experts. They pay that monthly subscription that allows them to post any and everything related to their practice, their company, to their level or area of expertise, and they have the unique opportunity to do so in an environment that is kind of free from influencers, right? Because when we are onboarding some of these experts, these women are highly vetted, I should say women and men, they're highly vetted, credentialed, and they have a unique place in the internet where they are not competing for space, time, and attention with beauty influencers, for example. Wingwomen is nice in that it creates our own little area of the internet to give actionable advice to women who need it the most. And then aside from people like Sarah are the big guys, right? Those are the health insurance companies. Those are the wellness centers. Those can be rehab centers. They can be health and wellness brands that have products that may appeal to people like Tiffany or other women that are up and coming and on the rise for them to enhance their life and enhance their day-to-day health regimen. So the stats. Right now, we launched beta on 4/20, so just a few weeks back. And in that time period, we've started to onboard roughly 250, 260 users. It's going to be a process, but just out the gate with beta to the public, I think that these are pretty good. So we have about 100 users that are just like Tiffany, up and coming women who are on the rise. We've got about 160 licensed professionals that we're onboarding onto the site. We're making sure that they know how to use the site, how to leverage it, how to post, and how to provide information to people that are interested in getting their advice and tips. And then people like Jeff are a part of the phase 2 rollout when we really start to focus on working with HR representatives, and we're going to be helping them to get onto the platform between now and the top of next year. Now, from a financial standpoint, we've had a few different things happen in our favor, and some we're still working towards. So to start, I personally bootstrapped $35,000 into the business. Additionally, I've received around $300,000 in software grants. We have not opened a round of funding yet, but when we do, the goal is $350,000. When we move into a seed round, the projected goal for now is around $3.5 million. And lastly, how would all of this be possible, and why should you invest in us, pay attention to us, spread the word? Well, it's because of our very unique team. I myself am not a developer, although I will state that I'm the one who built the entire platform as it stands now. But I have a very varied background. Believe it or not, I actually started my career as a weather woman, and from there pivoted into public speaking. I've written a couple of books. I've run for office. Now, as it relates to this space, it's quite unique because you can throw me in front of a crowd. I can pitch, I can sell, and I can talk about Wingwomen. I can talk about the end user because I have been her. I have been the ceiling breaker that has needed this level of support when I have stepped into these arenas. And so since it didn't exist at the time, I built it. Aside from me, there is a team that is over in India, and actually they have headquarters here in the US too, that I have been working with collaboratively to figure out how we're going to scale the platform. They're both with a company called Diane Apps, and their names are Parag and Vikash. I've been working with them for roughly 7 to 8 months. And then lastly, how does this all work if I am out there pitching and guiding the platform with my fellow developers there? It's with the help of my advisors. One is Dr. Akila Reynolds. She is an advisor. And the other, who is going to continue with me as an advisor, is Mac Conwell. He happened to be my mentor in this program. But aside from that, he's known affectionately on Twitter as Mac the VC. Check him out. Thank you so much for your time today. I believe we're going to go ahead and take a question from Kate. But again, just in case you want to reach out, here's my cell phone number. And here is the web address once again. Thank you so much.
Adonica, thank you so much for your time today. That is fantastic. You've got a couple of positive comments there in the comments section, as do many of our founders. Very quickly, this market could be seen as really broad. Can you spend just a couple of seconds on how you're thinking about user acquisition?
Absolutely. So one of the learning points that we figured out very quickly is that when you say that you're health and wellness focused, that draws a lot of people to you, right? On the user side, it's women who happen to be professionals who are looking for any and everything self-care, mental health, and just want to seek that care. But on the other side of that happen to be professionals who are the therapists, who are health and wellness experts, who are holistic practitioners. And so right now with user acquisition, we're focused on a little bit of both, although I will say more of our goal for the immediate future is to onboard more licensed and credentialed professionals, because not only will they help to de-risk the platform as it expands and scales, but they will also be there to provide that level of experience and expertise so that as we're onboarding users, they have somebody there to address their questions. In terms of a hard ask, if there's anybody that's listening to this or will see this recording, I would definitely welcome support in this area in terms of strategic user acquisition for these two types of users.
Great. Adonica, thank you so much.
Thank you.